Hi everyone, Brian here for another segment. So today we are going to go over different assessment tools for the thoracic spine. So in previous segments we looked into the cervical spine, so both upper, middle, and lower. So now we're moving down the back a little bit. So for this first section we're going to go over flexion, extension, lateral flexion to both sides, and rotation to both sides, only of the thoracic vertebrae. So for this segment, I'm going to make sure that Ryan doesn't slouch. A lot of patients, a lot of us have bad posture and we're always in a slouching position. So for this, I really want to see what movement he can get. So I'm going to ask, Ryan, can you sit up as straight as possible? Perfect. Also, I'm going to ask Ryan to put his hands on his shoulders for me. Perfect. Okay. So the first movement we're going to do is flexion of the thoracic spine. So for this, I'm going to ask Ryan, can you bend forward for me? Oh, good job. So in this, I only want his upper portion to bend, not using the lower lumbar spine. How does that feel?
Yeah.
So now, since he's able to do this pain-free, I'm going to apply a little bit of overpressure. So I'm going to place my hand right on the top of his thoracic area. I'm going to apply pressure straight down. How does this feel?
Good.
Good, perfect. You can relax. So for this next movement, we're going to do extension. So for this, I'm going to have him keep his arms on his shoulder and bend backwards for me, only using the top part of your back. So can you bend? Good job. How does this feel?
Good.
Good. So for this, I'm going to apply a little bit of overpressure. How does that feel?
Good.
Perfect. Note that I'm blocking so that he doesn't get too much motion in the lumbar spine. Awesome. You can relax, go back to neutral. Next we're going to go to the side, so we're going to do a little bit of side bending. So for this, I want you to try to bring the upper part of your chest down to the side. How does that feel?
Good.
Good? Okay, so for this one, I'm going to apply a little bit of overpressure too. I'm going to support his body on this side, and I'm going to press him into it. How does this feel?
Good.
Perfect. Return back to the middle and go to the other side for me. Any discomfort with this?
No.
Perfect. Again, I'm going to just get a little bit of overpressure. You can return back to the neutral, natural position. So next we're going to do rotation. So for this, I'm going to say, Brian, can you rotate towards me using only your upper back? So can you turn towards me? How does that feel?
Yeah.
Perfect. So now I'm going to apply a little bit of overpressure. So I'm going to block his body so it doesn't shift. I'm going to rotate him slightly. How does this feel?
Good.
Perfect. And we'll try the other side. Doreen, can you rotate to the other side? Perfect. And I'm going to, again, block with my body and rotate a little bit more. How does that feel?
Good.
Perfect. You can relax. So those are the three movements. So we did flexion, extension, lateral flexion to both sides, and rotation. So that's all I have for this segment. Thank you. Hey guys, Brian here again. So in this next section, we're going to observe the movement of the ribs. The ribs play a critical part in the motion of the thoracic area. So for this first one, we're going to check out the first rib. So the first rib sits right under the upper trapezius muscles, so right up here. So to find this, you'll find T1 and then shift out laterally and a little bit anteriorly. So out to the side and to the front until you feel the ribs right under your fingers. A lot of people might have very developed upper traps. So for this, you might have to do a little bit of palpating to find it. But I have found Ryan's, and that is perfect. So for this, I'm checking to see how his ribs move during breathing. So during inspiration, they should rise, and during expiration, they should fall. So I'm feeling them right under my fingers. And Ryan, can you breathe normally for me? So during this, I'm really feeling to see if the ribs are moving appropriately. And I'm checking for symmetry and motion between the two sides, and it feels very the same. So good job, Brian. So I'll observe for a few more breaths. Perfect. So that's all I have for you, and that's checking out the first rib during inspiration and expiration. So that's all I have for this segment. Thank you. Ahoy hoy! It's Brian again. So this time we're going to check out the rest of the ribs, the motion of the rest of the ribs. Earlier we checked to see the motion of the first rib. So this next section we're going to focus on a little bit lower. So the ribs are broken up into two different sections. So there's the upper ribs and the lower ribs. These upper ribs should move in a pump handle motion. So that means it should move anterior to posterior as he breathes in and out. The lower ribs should move medial to lateral. So as he breathes out, they should move laterally. As he breathes in, they should come in medially. So to assess this, I'm going to position myself at the top of Ryan. I am going to find the manubrium of his sternum, and there's a little ridge right there, and then I'm going to shift out, and I know that I am at the second rib. So can you breathe in for me? Good. And I'm feeling for the rise and fall and symmetry between the ribs again. And I'm going to shift my way down, staying relatively close to the sternum. Can you breathe in and out for me? Perfect. Just observing the motion for each of the ribs. It's very important that the ribs move in the right way, appropriate to the section. And now that I'm getting lower, I'm going to shift to the other side. I'm going to feel right on the side. And can you breathe in and out? Perfect. And I'm feeling for that in to out motion of the ribs here. Still feeling for symmetry of motion between the sides. And down. Last one. Perfect. So that is how you check for symmetry of motion and appropriate movement of the ribs. That's all I have for this section. Thank you. Well, hello. Brian's here again. Today we're going to check out the motion of the first rib. So this is a first rib spring test. So for this section, we're trying to feel the recoil of the rib. So for this, you're going to use right in the webbing of your hands. You're going to find the first rib. You're going to press down towards the other hip and then feel it bounce back. So it's important that you apply a good amount of pressure when doing this so that you can really feel the rib move through the motion. While doing this, we're looking for symmetry of motion as well as smoothness and a good recoil. So I will show you. I'm going to position myself at Ryan's head. I'm going to feel for the first rib. I'm going to get my hand right in there. Ready? And press. And return. And I will feel the other side now. Hand in. Press. And return. So when doing this, I'm really feeling for that rib bouncing back into my hands. That's all I have for this section. Thank you. Hello, Brian here again. So for this next section, we're going to check the motion of the ribs. So this is a spring test for ribs 2 through 12. So for this, I am going to find the 12th rib. So for this, I can come in and feel the first bony landmark. So if you have trouble finding the rib, you can start lower and slide up into it. Perfect. So for this, I'm using a hand, kind of like a karate hand. I'm going to find the angle of the rib. I'm going to place my hand in the angle that the space between the rib is. I'm going to use my other hand to cup over, and I'm just going to apply anterior pressure, so pressure to the front, feeling the rib pop up. And then I'll shift up, down, and up. And when doing this, I'm feeling for the motion of the rib. I want to make sure that the rib has good motion down and good recoil up. How does this feel?
Yeah.
So I'm working my way up. As I get closer, I'm going to run into the scapula. When I run into this bone, I'll shift a little bit more medial and try it, but there's going to be a point where you just won't get that good motion. And that's where you stop, because there's a lot going on in the area. The ribs are now hiding under the scapula. So I will check now the other side. And for this, I'm feeling for hypermobility or hypomobility. So hypermobility is too much motion. So this is if the rib goes all the way down and then comes up very quickly. And hypomobility is if the rib does not move at all, if it just feels very stiff and slow to recoil. Oop. How does this feel?
Yeah.
Perfect. And most of the pressure is coming from my top hand, pressing down into it. I'm making sure to find the angle of the rib each time. And my hand's in the same direction as the rib. Perfect. Down. A bit higher. Down. We'll shift in. Press down. So I got to scapular level, so I'm moving more medially. Seeing what kind of motion I get. And we're stopping right about here. Because at this point, I'm just running into a lot of restriction from the scapula. That's all I have for this section. Remember, you want to feel that nice recoil back into your hands. That's all I have for you. Thank you. Well, so this is the last test we'll be doing today. This is passive spring test of the thoracic spine. So unlike the ribs, we're actually checking the movement of each vertebra, T1 through T12. So first I'm going to identify T1. So for this I'll find C7. And if it's difficult to find C7 on the patient, you can have the patient slightly bend their head for you. And you know that C7 is a moving one, T1 does not move. So I have found T1. Perfect. So for this I'm using my hypothenar eminence. So right in through here. I'm going to put it right on the spinous process of T1, like so. And then I'm going to use my other hand to press into it and back up. And I'm going to work my way down, really feeling for the movement. And just like for the ribs, I'm assessing to see if these are normal movement, hypermobile, or hypomobile. So hypermobile is excessive motion, so that's if the vertebrae just really goes down really quickly. Hypomobile is limited movement, so that's if it just really won't move. So far, Ryan has pretty good movement for all of his thoracic vertebrae. I'm really feeling for his his spinous process in my hypothenar eminence. So when I start to get lower to like thoracic vertebrae 10, 11, and 12, I'm going to shift my angle up a little bit. So before I was just pressing anteriorly. Now I'm pressing a little bit more superiorly and anteriorly because the way the facets start to change because they're starting to turn into lumbar vertebrae. And I'm going to stop right there. So that is the last test I have for you today. I hope you enjoyed the video. If you did, please hit a like and subscribe for more content. We have a lot more coming. We have a lot more tests, a lot more assessment. So I'll see you next time for lumbar vertebrae. Thank you.